question I get asked all the time is, Bryn, how do you know what stethoscope is the best for medical school? And in this video, I'm going to break down the most popular stethoscopes for medical school and ultimately which one you should walk away home with. Hi, I'm Bryn. For those of you who don't know me, I'm a third year medical student studying in the UK. I am here to help you on your medical school journey throughout all the steps. One thing I have noticed when doing my research for this video is that it is so common for people to not actually know what stethoscopes are used for and their functions. And believe me, there are so many roles and functions a stethoscope actually does have, both in the hospital and in the clinic. So if you're becoming a medical student, you're going to want a stethoscope that is reliable, can be used in a variety of settings, that will last you for a while, and that is quite cost effective. Because in medical school, you're going to be on a variety of placements, all the way from pediatrics to elderly, from cardiology to respiratory, and you need a stethoscope that can listen to a variety of sounds in a variety of people with a variety of conditions. Ultimately, you're going to be listening to a lot of things, so your stethoscope needs to be able to do that. So, you're probably asking, what even makes a good stethoscope? I would say it boils down to these three things: its function, its utility, and its cost. A stethoscope's function is down to its user. If you were to give a consultant the world's worst stethoscope and a brand new medical student the world's best stethoscope, the consultant will come on top every time. This is because the consultant knows how to use it effectively. And the consultant's going to know what to be listening for, what to be looking out for, whereas a medical student isn't. Next is utility, which is how much use the stethoscope provides to someone. Let's give some examples. You can have cardiology stethoscopes, which are really good at picking up specific heart murmurs and some heart sounds. You can have some stethoscopes where you can record the sounds you hear and play it back for revision purposes. You can even have some stethoscopes that are used for children because they're really small in size. So each of these utilities are useful for different areas of medicine. So, as for a medical student, if you're applying to medical school or a nursing school or to be a paramedic, you're going to want to have a stethoscope that can tick off all the areas of utility. Because remember, you're going to be seeing people of all ages with all conditions. So you want something that at one moment can listen to a child's chest, and then at another moment can listen to an elderly person's chest, and then at another moment can pick up the sounds of pneumonia. You want to cover all of these areas with your stethoscope. So you want it to be high in utility, and I have the exact recommendation for that. And finally, an obvious one is cost. Cost is pretty easy to determine. You want something to be as cheap as possible and something that will last you as long as possible. Obviously, we are students, we're going to want to be saving money, and I've chosen out the one that's going to save you the most money. And with them three things out of the way, let's get into it. So the king of stethoscopes I recommend to people, and that I even use myself, is the Littmann Classic III. I mean, where do I even start with this? On the graph earlier, let's consider the functionality to utility rate. It is both just so high on each scales. It's such a versatile stethoscope, allowing you to listen, as I've already said, to a wide range of patients, a wide range of body areas with a wide range of conditions. What I love about it is that 1 minute you can be listening to the lungs of a child, and then the next minute you can be on a gastro ward listening to tummy sounds, and then the next minute heart murmurs on a cardiology ward. Which is just perfect for a medical student because you're going to be flexing between each wards day in and day out. And even when you become a doctor in your residency years, even when you're a paramedic or a nurse, you're going to be seeing a wide range of patients who will have a wide range of conditions. So the Littmann Classic III, due to how versatile it is the perfect stethoscope for medical students, nursing students, and paramedics. Equipped also with a bell on one side and a diaphragm on the other side, the Littmann Classic III allows for a perfect resonance of sound, so you can hear so many different sounds indicating so many different conditions. And this once again goes into the function of the stethoscope. Having both the bell on one side and the diaphragm on the other side allows the user to use their own skills and detect so many more conditions just with this little addition of the bell on one side and the diaphragm on the other. Another lovely feature about having this dual-sided stethoscope is that you can use different sides to listen to different areas. Listening to the apices of the lungs, you can use the bell of the stethoscope because it can fit within the collarbone. And also listening to pediatric sounds because it's a lot smaller. You can listen to the small chest of the children a lot easier. Whereas the diaphragm can be used for bigger areas like the chest and hearts of an adult lung. And it's a lovely little addition to the stethoscope, which isn't that common, having a bell on one side and a diaphragm on the other. As for utility, you can't go wrong with the Littmann Classic III. It will just last you forever. I know consultants personally who have had theirs for over 25 years. They bought it in medical school and it still works to this day. And as I've already said, the amount of sounds it can pick up, which is so useful for you, which crosses over the functionality and utility, allowing you to listen to a variety of sounds, which is so important for diagnostic medicine. And finally, the cost, the time you've all been waiting for. The Littmann Classic III goes for around £100, give or take, which, yes, does seem expensive, but considering if you're in medical school for 5 years, as most people are, that's going to be £20 per year of medical school just for one stethoscope, which I've already said lasts many people over 20 years as a doctor. This is no stethoscope just to use in medical school and throw away. It is one that will last you for life. So yes, the £100 can seem quite expensive and quite daunting, and there are cheaper options, but honestly, I recommend investing this money immediately when you join medical school, nursing school, or paramedic school, and it will last you so much longer than the other stethoscopes, which might not last you as long. And with the £100 comes a few more nice little additional add-ons. You can get colour customization. You can also get your name engraved in there. I know some people choose to have doctor in there. Some people say that's a little arrogant. I don't think it's too arrogant because one day you might actually be a doctor. I personally didn't get this done. I just got Bryn Irons in the stethoscope, but I know some people that do have doctor and then their surname because it will be useful when they do become a doctor. And like I said, it's going to last you until you're a full-grown doctor, so you might as well customize it while you can. I know some people also get religious texts and quotes they like. They get quotes they like from films. It's just really nice. You can write little embedded things to remind you when you're practicing medicine of something nice and sweet. And I love this idea of just it being customizable. You can really show off your personality as small as things like quotes and color on the stethoscope. And I think it's a really nice icebreaker. People can ask you questions about it. And it's something cool to show patients as well if they're ever curious. So, we've covered the one I recommend and the one you need, the Littmann Classic III, the king of stethoscopes. However, what other options are there for you? So first, we have the Littmann Cardiology series, which is really good at serving its function in cardiology. They have very high quality sounds and can detect some really quiet murmurs the Littmann Classic III can't. Remember, Littmann Classic III is for generalists, the Littmann Cardiology is for specialists. The only downside to the cardiology stethoscope is the user and the price. So as I've said, something's function comes down to the user. If you're a medical student, nursing student, paramedic, you're not going to know how to listen to the quietest murmurs of all. You won't even know what they sound like because you don't have the experience. So there's not much point to getting a stethoscope you can't use to its full potential, which is why function of a stethoscope and the user is so important. In addition to this, another big downside is the price of the stethoscope. The Littmann Cardiology series will set you back a few £100s just because of how extreme and prestigious it is, and it's generally reserved to registrars and consultants training in cardiology. But you might come across it as you research for stethoscopes. I personally would stay away from this one though. So unless you're going to be becoming a cardiologist, I don't recommend this one for medical school. Also, another one you might come across when you research are the ADC series of stethoscopes. Now, a lot of people have a preference for these because they are a little cheaper than the Littmann series. But with a price reduction also comes a reduction in the quality. The ADC series just aren't as good, they're not as robust, they don't listen as well, the sound quality is a lot worse than the Littmann 3. However, the one good thing about them is it is cheaper. So if you're trying to budget with a stethoscope, maybe you need one for a year or two in your clinical years and you don't plan on doing clinical medicine afterwards, maybe the ADC series are for you. And one other limitation, as I've said, there's no personalization, no customizable features. So if you want a long-lasting, nice stethoscope that's a nice memory to have, I would recommend the Littmann Classic. But as I've said, if you only need one for a few years for whatever reason, the ADC is a nice, more friendly budget option for you. But an even better, perfect budget option stethoscope that will last you for a long time and that is lightweight is the Littmann Classic Lightweight series. Now this stethoscope is a lot more popular in other students in healthcare who don't need to use a stethoscope as much but will need it just in case. So I'm thinking paramedic students, nursing students, practitioners associate students. They won't need a stethoscope on hand all the time, so they can opt in for a cheaper stethoscope like the Littmann Lightweight, but this one's a little bit cheaper and it still has a very similar background and capabilities of the Littmann Classic III. Obviously, with a cheaper price comes a reduction in some of the use of the stethoscope, but it's a pretty good stethoscope if you don't need to be using one day in and day out. And it's another one I would recommend if you don't want to get the Littmann Classic III. It's a lovely, lightweight, classical stethoscope with customizable features as well, and it's just great if you want to have a stethoscope but don't want to spend all of the money. I personally recommend this over the ADC if you're looking for a temporary and budget-friendly stethoscope. And also, if you have a really weak neck and you don't really want to be holding a bulky stethoscope on you the whole time, that's fine. Consider the Littmann Lightweight series because it is a lot lighter than the Classic series. So overall, as a third year medical student, I always tell new medical students to go for the Littmann Classic III, as I've already discussed, because of its great function, its great utility, and its decent price that's associated with it. And I think it's so nice as a medical student, paramedic student, nursing student, or any healthcare student to just treat yourself. Get a nice customizable stethoscope with your name engraved in it or a quote in it, or just a nice friendly reminder. You're going to be on the wards day in and day out. It's just quite nice to have a stethoscope that will serve you well and that you can enjoy the use of. So with a stethoscope that can do all of these features and that has amazing customizable features seems good to you, I would strongly recommend getting the Littmann Classic III. For those who want to save a bit of money, you could consider the ADC series, and for those who want a Littmann still but want one that's a bit lighter and still customizable, but who want to save money, consider the Littmann Lightweight series. And unless you're becoming a cardiologist or a consultant, I would stay away from the fancy cardiology stethoscopes. And that's everything for this video. If you're going to nursing school, medical school, paramedic school, any kind of healthcare related school, and you want a bit more help and guidance on how to get through it all, please consider subscribing to this channel. We have tons of videos coming out on how to get through healthcare related courses and how to stay on top of everything, as well as cool little features like what stethoscopes to buy. And if you found this video useful or you've liked the content, consider liking and subscribing. It helps a huge deal. And if you have any questions regarding stethoscopes or just university life in general, drop them in the comments and I will get back to all of them. And as always, thank you for watching and see you next time.